Patients with cancer are at increased risk for infections, and the infections can lead to hospitalization or even to death. The reason they're at increased risk for infections is twofold. The first is the cancer itself may suppress their immune system, making them at increased risk for bacterial infections, infections like tuberculosis, but also the treatment of the cancer, which helps suppress the cancer, can also suppress the immune system, making them temporarily at increased risk for infections. And so I'm going to be talking about how we can help prevent those infections both at home, in the clinic, and in the hospital, but also what the approach is to treating those infections so that the patients don't get sick from the infection and they can continue on with their treatment of their cancer.
Essentially, the big message I have that in treating cancer, malnutrition is what you want to prevent. During the treatment of cancer, whatever treatment they use, chemotherapy, radiation, surgery, you need to be well nourished. Oftentimes, the patient gets many side effects. They can't eat, they don't have appetite, just all the symptoms. And the point is that no matter what, nutrition is very important. If the person does not eat because of anorexia or whatever, they become cachexic. What that means is that they start to actually use up the very muscles of their own body for nourishment. And once they get at that stage, there's really no turning back. Just very few people recover from cachexia. So that the bottom line is that you must feed the patient. And the other part of my presentation is on medical nutrition therapy. I would really like for all the people here today to learn how to do that. It's assessment, and in that assessment you get to find out what the person is eating, and it's a very individualized therapy so that you give them exactly what they will eat. You have to work with them. It's like constant, because you must get food in. The other thing that's very important is sometimes you have family involved, and so you have to work with the family too.